in this video I'm going to show you a cardiac rehabilitation setup, how it works, right?
Okay, so the first thing here is the sanitizer. You need to sanitize your hand properly before touching the patient. This is the examination table where we can assess the patient and also can lie down the patient if needed. This is an adult sphygmomanometer with a stethoscope which is used to measure the blood pressure of the patient. These are three important gas pipelines, so let's check what is what. Okay, now let's see the MGPS, that is medical gas pipeline system. Here you can see three pipelines. Okay, the first one with this white box is basically delivering oxygen to the patient. Now this is a flow meter which basically controls the amount of oxygen given. This black box is called vacuum, which basically used for medical suction. Now this box, the third box with this grey color, is called compressed air release, where blending agent or drug is delivered with medical oxygen at a pressure of 370 to 400 kilopascal. And lastly, the yellow box is called theater vacuum terminal unit, where the suction catheter is connected. Now let's see the color coding of these pipelines at a glance. This is called an adult crash trolley or adult crash cart. As the name suggests, it is a self-contained mobile unit that contains virtually all of the materials, drugs and devices necessary to perform a code. Due to privacy reasons, I cannot show you the items inside, but in the slide you can check out what stays inside a crash trolley. This is an automated external defibrillator machine which comes with the crash trolley, as it can perform most of the important codes. This machine basically restarts the heart to stop the irregular beat or irregular heart rhythm when the patient is suffering from a ventricular fibrillation or, in layman's term, cardiac arrest. This is a bedside SpO2 patient monitoring system, which is basically a pulse oximeter that measures the oxygen saturation in blood alongside with the heart rate. So when a patient comes to the department, we first check the vitals of the patient with this machine. So here we can see two cycles, right? First is the short one and the second is the long one. Both of these are called static cycle. These help in improving the vital capacity, which in turn increases the cardiac endurance. These are called Swiss balls. In a cardiac rehabilitation setup, we can use it for various core exercises, balance and mobility training, along with some stretching activities. Cardiothoracic incision weakens the shoulder muscles, so a shoulder wheel is needed for improving shoulder range of motion. This is an elliptical cross-trainer machine. It strengthens the heart, lungs and muscles, which increases aerobic endurance, improve balance and burn calories. It is a treadmill where we can do a stress test or an exercise tolerance test, like following the Bruce protocol, to understand the patient's aerobic capacity. It is also used to increase the overall cardiopulmonary capacity of the patient. This is a weight machine where we can measure the body weight of the patient to calculate the BMI. This is a chest fly machine which is mainly aimed to train the pectoralis muscle that commonly gets cut during the cardiothoracic incision. There is an associated shoulder press machine with it which improves the upper extremity strength. Remember, this is a high intensity resistance program which is included in the latest stage of cardiac rehabilitation. Some of the other things used in a cardiac rehab setup includes weight cups and dumbbells to train the extremity muscles.
So these are all you can see in the cardiac setup. I hope you liked the video, and if you do, then please like, share and subscribe to my channel, and also press the bell icon, and you can also follow my Telegram channel. Thank you so much. See you in the next video.